Alright guys, so we're going to start off with the anterior palpations. First off, we have the anterior superior iliac spine. So you find your iliac crest, walk your way down until you find the most bony prominence in the front. Below that, it's a little bit harder to find, you got to really press in, is going to be your anterior inferior iliac spine, AIIS. And then we have the pubic symphysis, which is not normally palpated, but it's in the middle. And then from there we have the sartorius. So if she goes ahead and goes into like a tree position, you can kind of feel the muscle that runs across from the anterior superior iliac spine and across down to the middle part of the knee. So it kind of makes a line that goes across. And so you can palpate that right in the middle of the thigh. And then the other one is the rectus femoris, which originates at the anterior inferior iliac spine. And so if she brings her leg back down to normal or neutral, we can palpate that. If you find the anterior superior iliac spine, go down one, and then follow your hand down. It's going to make a line that runs down to the quadriceps tendon, which is right down here. So you can palpate that in the middle part of the thigh. And now for the medial palpations, we have our adductor group, which is right here in the middle of the thigh. The adductor longus runs all the way down on the medial part. And then you have magnus, which comes across, and it's more of a meaty muscle, and so you can palpate that in the middle of the thigh, the medial part. And then the abductor brevis is a shorter muscle that runs right in here.
Alright, so first we'll palpate the iliac crest. So you'll find the hip bone and the top of it, and that is your iliac crest. Next we will find the tensor fascia latae. So we're going to find the ASIS, which is more in front, and then you're going to go a little down and medially, and so that's going to be the muscle right there, and then that will turn into your IT band. So then you'll palpate following down here, and it's just going to run all the way down the leg right here, and so you'll palpate that all the way down. And then next is your gluteus medius. So then you'll find the iliac crest again, and you'll go behind it, and it's going to be right above like your shorts line, so right in there. It's going to be that muscle. We'll palpate the greater trochanter, which is right in here. So you're going to ask the patient to lie supine, lift a leg, and then slowly rotate. Yep, and then you'll be able to feel it move. So it's right in there, and then right above that is the trochanteric bursa, which is right over it, and that you will only feel if it is inflamed or in pain.
Okay, so for the posterior, we're going to start off by working your way down from the crease in the back and getting to right here in the middle. Right above the butt crack, we have the median sacral crest, and if you work your way out to the side a little bit laterally, you'll be able to find their PSIS, which is a posterior superior iliac spine. It's really easy if they have back dimples like she does. And if you palpate a little bit lower, that's about where it is. And if you go a little bit more inferiorly, that's where your SI joint is. And this whole superficial muscle right here is her glute max. So if you palpate the glute max further and ask your patient to put her knee on the table, you can do that, please. If you palpate a little bit harder, you can find the ischial tuberosity and bursa, and right there is where the hamstrings originate. And if you go laterally from that, it's about halfway between the ischial tuberosity and the greater trochanter. You'll find the sciatic nerve, which is also where the piriformis muscle goes over.